بسم الله الرحمن الرحيم. هنبدأ الجلسة السادسة. أول سبيكر دكتور عبدالعزيز أحمد, Scapulothoracic Abnormal Motion. Let's start.
Perfect. Can everyone hear me clearly?
Yes, we can hear you clearly. Thank you. Appreciating your time and your effort.
Thank you. So today I'll be speaking about progressive motion evaluation management. So these are my conflicts of interest. Nothing that's really relevant to this topic. So why did I pick this topic? And why do I like this scapula? The scapula, this picture is very interesting. I generated this on ChatGPT. And I think it simplifies the scapula topic. So the scapula is that house of the
Dr. Abdelaziz. Dr. Abdelaziz, we are exceeding the time by about 5 minutes.
If you want me, I can stop now.
No, you can summarize the rest of it.
Sure. So, and then for this one, we could do, we can do scapulothoracic artery, which is where you fuse the scapula with the wrist, and then you can resolve and you'll have both muscles to work. This has eye complications. And just for the interest of time, this is functional stem. You can have mild stem when there's mild imbalance. And typically what I do for this most of the time is going to be, most of the time I'm going to do that off. But when I need surgery, I would do picture on the spinal release. So it's done arthroscopic, and I identify the vertical plexus here. Or it could be severe functional stem, and that's a problem. And in these patients, we can dissociate with shoulder. And for these ones, if we don't respond to an operative treatment, I would do pictorialis minor. Let me show you here. Pictorialis minor release as well, and I do scapulopexy. And that's where we have great outcomes as well. Finally, the one that I'm going to talk about a lot, which is the dystonic scapula. This one is where the scapula is fixed to the chest wall and you can't for it back between fusion. Or dancing scapula, where the scapula keeps dancing by itself. And that's also a hard one where you could do scapula preparing for, or you could do basically scapula thoracic fusion. And this is like the difference where you pass a graft and put it from one side to another. Like an piece and then graft. You can tie them together as well. And do a publishing on this. So, just a take-home message, I think foundation first, the scapula is unstable, the ligament movements will be compromised. Take the scapula, the curiosity, mostly non-operative fusion, so that's a good thing about it. And refer when needed to scapula surgery or shoulder surgery. And there are two problems, structural, which is predictable, but also you get functional problems, which are less predictable as well. Thank you.
Dr. Karima Abdelawi, rehabilitation of scapular problems. الحقيقة موضوع السيشن دي كلها مهم جدا لدكاترة العظام، جزء مهمل الحقيقة كتير في شغلنا، وفي حين ان اغلب نتائجنا مرتبطة بشغلهم. برضه احب انوه ان في جامعة عين شمس بدأنا ماجستير للطب الرياضي واصابات الملاعب، اول دفعة بتمتحن دلوقتي، فاللي يحب يجوين ممكن يسأل عندنا في الاسم. فرصة كويسة جدا بيشتغلوا في اصابات الملاعب. will be advantage. تفضل دكتور كريم.